Understanding disease transmission. Disease transmission is a critical concept in public health. It refers to how diseases spread from one person to another. This can happen in many ways. Sometimes it's through direct contact. Other times, it might be through the air we breathe. Understanding how diseases spread is crucial. It allows us to take steps to protect ourselves and our communities. When we know how diseases are transmitted, we can make informed decisions. We can practice good hygiene, like washing our hands frequently. We can get vaccinated to protect ourselves and others. We can also take precautions when someone is sick, like staying home to avoid spreading germs. By understanding disease transmission, we can help break the chain of infection. This means stopping the spread of diseases from one person to the next. It's a collective effort that requires everyone's participation. The two types of diseases, communicable and non-communicable. Diseases are generally classified into two categories, communicable and non-communicable. Communicable diseases are contagious. This means they can spread from person to person. The common cold is a good example. It's caused by a virus that spreads easily through coughs and sneezes. Other examples of communicable diseases include the flu, measles, and COVID-19. These diseases can have a significant impact on public health, especially when they spread rapidly. Non-communicable diseases, on the other hand, are not contagious. They are not caused by infections and cannot be spread from person to person. Heart disease, cancer, and diabetes are examples of non-communicable diseases. These conditions are often chronic and develop over time. Factors like genetics, lifestyle choices, and environmental exposures play a role in their development. How diseases spread: direct contact. Direct contact is one of the most common ways diseases spread. This involves physical contact between an infected person and a healthy person. One example is shaking hands with someone who has a cold. The virus can be present on their hands and transfer to yours. You can then become infected if you touch your eyes, nose, or mouth. Another example is kissing someone with a cold sore. Cold sores are caused by the herpes simplex virus, which spreads through direct contact. Sexual contact is also a form of direct contact that can transmit various diseases, including HIV and chlamydia. It's important to note that not all contact with an infected person will lead to infection. Our bodies have immune systems that help fight off germs. However, the risk of infection increases with prolonged or repeated contact. Practicing good hygiene, like washing hands frequently, is crucial in preventing the spread of diseases through direct contact. How diseases spread: indirect contact. Diseases can also spread through indirect contact. This happens when a healthy person touches an object or surface that has been contaminated with germs. For example, imagine someone with the flu touches a doorknob. They leave the flu virus on the doorknob. Later you touch the same doorknob. The virus transfers to your hand. If you then touch your face, you can become infected. Other examples of indirect contact include sharing utensils, towels, or toys with someone who is sick. These objects can become contaminated with germs and spread the infection. It's important to clean and disinfect frequently touched surfaces, especially in homes, schools, and healthcare settings. This helps reduce the risk of indirect transmission of diseases. Section 5. How diseases spread: airborne transmission. Airborne transmission is another way diseases spread. This occurs when tiny droplets containing germs are released into the air when an infected person coughs, sneezes, or even talks. These droplets can remain suspended in the air for some time. Others nearby can inhale them. Diseases that spread through the air are often respiratory infections. These affect the nose, throat, and lungs. Examples include the flu, measles, and tuberculosis. The size of the droplets plays a role in how far they travel. Larger droplets tend to fall to the ground more quickly. Smaller droplets can linger in the air longer and travel farther. This is why ventilation is important in enclosed spaces. Good ventilation helps remove these droplets from the air and reduce the risk of transmission. Section 6. Preventing the spread of diseases: hygiene and vaccinations. Preventing the spread of diseases is a shared responsibility. One of the most effective ways to protect ourselves and others is by practicing good hygiene. This includes washing our hands frequently with soap and water for at least 20 seconds, especially after using the restroom, before eating, and after coughing or sneezing. If soap and water are not available, Hand sanitizers containing at least 60% alcohol can be used. Covering our mouths and noses with a tissue or our elbows when we cough or sneeze is also essential. This helps prevent the spread of droplets containing germs. Vaccinations are another crucial tool in disease prevention. Vaccines work by introducing a weakened or inactive form of a germ into the body. This triggers an immune response. The immune system then learns to recognize and fight off the actual germ if it encounters it in the future. Section 7. Preventing the spread of diseases, food and water safety. Food and water safety are essential aspects of disease prevention. Consuming contaminated food or water can lead to foodborne illnesses, which can cause a range of symptoms, from mild discomfort to severe illness. Proper food handling practices are crucial in preventing contamination. This includes washing hands thoroughly before handling food, cooking food to the appropriate temperature, and storing food properly. It's also essential to ensure that water comes from a safe source. If unsure about the safety of water, boiling it for at least 1 minute can kill most harmful bacteria and viruses. In areas with limited access to clean water, water purification methods like filtration or using water purification tablets can help reduce the risk of waterborne diseases. Section 8. The community's role in disease control. Disease control is not just the responsibility of individuals, it requires a collective effort from the entire community. Communities can play a vital role in preventing the spread of diseases by promoting awareness about public health measures. This includes educating people about good hygiene practices, the importance of vaccinations, and how to recognize and report symptoms of infectious diseases. Community health workers can play a significant role in reaching out to underserved populations and providing health education and resources. Communities can also support public health initiatives such as vaccination drives, disease surveillance programs, and vector control measures. By working together, communities can create a healthier and safer environment for everyone. Section 9. Technology's role in disease prevention, a new era of health. Technology is playing an increasingly important role in disease prevention and control. Mobile health apps, for example, can provide personalized health information, track symptoms, and send reminders for vaccinations. Telemedicine allows healthcare providers to consult with patients remotely, reducing the need for in-person visits and potentially limiting the spread of infections. Contact tracing apps have become valuable tools during outbreaks. They use Bluetooth technology to track close contacts of infected individuals. This allows health authorities to identify and notify those who may have been exposed and provide guidance on testing and quarantine. Artificial intelligence and big data analytics are also being used to develop early warning systems for disease outbreaks. By analyzing large data sets, these technologies can identify patterns and trends that may indicate an impending outbreak. This allows for timely intervention and potentially prevents widespread transmission.